Hello, everyone. Welcome to the Mouthy Matter podcast. I'm so excited because today I have Dr. Jennifer Eisenhuth. She is an orthodontist in St. Paul, Minnesota. She has been practicing private dentistry for 20 years, and she also is a part-time faculty member at the Minnesota Board of Dentistry. She didn't set out her path to create the Dr. Jen Natural toothpaste. But her story pivoted a bit in 2019 when her daughter became ill. Dr. Jen began researching for clean ingredient, remineralizing toothpaste she felt confident using with her own family. Finding the available options lacking, she turned to her scientific background and clinical expertise to formulate one herself. What began as a mother's determination evolved into the creation of a thoughtfully developed oral healthcare products grounded in both science and safety. Thank you so much for being here, Dr. Jen.
Thank you so much for having me, Tasha. This is exciting.
Well, I would love to hear about the origin story since you started off as an orthodontist. There's lots of orthodontists that don't create toothpaste. So share with us more about the creation of Dr. Jen Naturals.
Yeah, that's a fair question. I get asked a lot if I planned to create a toothpaste when I was in dental school, and I absolutely did not. But once in a while, I think we are all hit with curveballs from life, and occasionally you can find a silver lining. And that's really what we choose to see this toothpaste adventure as, because it's been a journey. And so our curveball was when our daughter became ill. It was in 2019. She was in college and she contracted something called diff, which is a pretty serious gut biome disease. And in fact, it's something that I learned about in dental school, but I didn't recognize just how sick these patients become because it's pretty severe. She was 22 years old and honestly knocked her down so that she couldn't get out of bed for months. And she was in and out of ERs and urgent care centers and GI clinics until somebody recognized that she had a fairly typical recovery to C. diff, which is one step forward and two steps back. So she was not thriving. She was failing. And the physician asked that she be admitted into the Mayo Clinic in Rochester, Minnesota. And so during her time there, I'm so grateful to the physicians for really explaining to her that her gut biome essentially was decimated with, due to an overprescription of antibiotics combined with exposure to a C. diff spore, very likely at a dental visit. And essentially she needed to rebuild and she needed to treat her biome kind of like an infant, and with an infant, we're really careful about the foods that we introduce. We're careful about the products that we use on them because they just don't have the resistance to some of the harsher, chemicals in American products. And so that's what they recommended Claudia do. So when they talked to her about diet, they talked to her a lot about products. And, laundry detergents and shampoos and soaps and toothpaste came up. And being in the dental field, I was actually pretty confident we could find, a clean ingredient, remineralizing toothpaste that would protect enamel. And I was very frustrated with what was available. And really nobody was following the science. Some brands were claiming to be clean when they were not. And it's essentially an unregulated area in the United States. In fact, fluoride-free toothpaste are considered a beauty product in the U.S., not a healthcare product. And so essentially, I, at some point, just out of frustration, turned to my husband and said, I think we're just going to have to make a toothpaste. And so we did. It really wasn't intentional, but it's grown from there.
Oh my gosh, I love that so much. I think it is just the wild, wild west when it comes to dental products. The more I research and the more I learn, the more I'm completely shocked that a lot of it I put in my own mouth for years. And a lot of it I recommended to my patients as a dental hygienist, not knowing, just assuming that it's got the ADA seal of approval. So it must all be clean. It must all be good and biocompatible and all the things. And so it's shocking that it's not. So you'd mentioned, having like a remineralizing toothpaste. So let's get into what remineralization is, what demineralization is, how this whole cavity formation process starts, because a lot of people suffer from tooth decay and recurrent decay and weak spots on their enamel. So how does this whole process work and how does hydroxyapatite really help that?
So essentially, there are a few different ways to strengthen our enamel. And we need to strengthen our enamel because the typical American diet is hard on the enamel, mostly. And So every time we eat carbs, sugars, things like that, and Americans, we love to graze all day long. So we love our snacks. And so all day long, essentially, Streptococcus mutans, which is a bug in our mouth, will take these carbs and these sugars and turn it into an acid. And these acids will challenge our enamel and our enamel will break down. Our enamel is actually hydroxyapatite. It's crystals of hydroxyapatite. And so during the acid challenges, we lose some of that hydroxyapatite crystal. We lose the calcium, we lose the phosphate, and that's demineralization. And that's almost like a softening of the enamel, and that's how we decay. Now, our saliva is really our savior and can balance the pH and can help us remineralize and strengthen the enamel. But unfortunately, our saliva is very slow. So when we take our last sip of a Starbucks, it takes almost 40 minutes for our saliva to balance the pH so that we can get on top of that demineralizing that has been occurring. So because our saliva is slow, because we challenge our enamel all day long, if we don't have something in our toothpaste that will remineralize, we won't be able to get on top of that system and we will decay with time.
I love that. That is such a great explanation. So what I get really confused about now is when I see, the dental professionals that I work with are emailing me all day long. What about this toothpaste? What about this toothpaste? What about this? And so there are so many, you go to Amazon and you hear about hydroxyapatite, and then there's like a bazillion different ones on there. There's nano, there's micro, there's different parts per million, labels that you're not quite sure. So when the consumer is going to purchase a toothpaste and invest their hard-earned money, because most of these hydroxyapatite toothpastes are quite a bit more expensive than going to, Walgreens or Walmart or Target and looking at the hundreds of toothpaste options there for a couple of bucks. And we're thinking like, oh, those are all probably fine. But now I heard something about hydroxyapatite and I do get cavities. What should the buyer know when they're looking at these labels? So what does the science say that we need to help our saliva along to really help to remineralize as we're sipping our Starbucks?
To strengthen. So essentially hydroxyapatite is really what our building block of our human body is. So it's in our bones and it's in our teeth. It's just calcium and phosphate. And Japan and in Europe, they've been using hydroxyapatite to strengthen enamel just as long as we've been using fluoride in the United States. So it's an alternate, right? But it needs to have certain conditions met to have the same effect and the same strength as fluoride. And that's really the crux of the situation. There are so many hydroxyapatite and nanohydroxyapatite brands in the United States that don't follow the guidelines. The European Union did an 8-year-long study, and I think we all recognize that in Europe, they protect their consumers really well there. They studied nanohydroxyapatite for 8 years to determine how effective is it and how safe is it to have in toothpaste. And they determined, yes, it is safe. It doesn't cross the blood-brain barrier. And then they created some guidelines for brands to follow in Europe. And so those guidelines, they're pretty basic. They follow the decades of science that is out there on nanohydroxyapatite. It needs to be a high concentration. It needs to be a really quality crystal. And that's in both size and purity of the crystal. You have to think about a nanohydroxyapatite crystal almost like a diamond. You know how there's different grades of diamonds? Nanohydroxyapatite crystals are no different. So you want to have high concentration with a really solid crystal to provide your teeth with the best protection. It is a really expensive ingredient to have in toothpaste. And that's why so many brands in the United States use a diluted concentration. It's expensive. So they sprinkle a little bit in. And, nobody's regulating this. And so they can say, oh, yeah, we have nanohydroxyapatite and we're going to fight decay. But when it's that diluted, it really doesn't fight decay to the same degree. So your teeth are not as protected as they need to be.
Gotcha. So if I'm reading a label, what do I want to look for? So what specifically tells me this has the ingredients that I want because I know that, I'm at risk for tooth decay or my child's getting tooth decay. What do I want to look for if I'm going to invest in a hydroxyapatite toothpaste?
That's a really tough question because it goes back to regulation. So brands it's not like fluoride where fluoride is regulated in the US. And so brands need to put the concentration on the packaging.
Okay.
Nanohydroxyapatite is not. And so it's generally not something that you can read on a label. You can reach out to the company to ask them what their concentration is, their crystal quality, things like that. Maybe they'll answer, maybe they won't. I will tell you, if I could have found somebody following the science in the United States, when my daughter was so ill, it would have been much easier to just buy that toothpaste. And so that's part of why I'm here. But we work really hard to follow the guidelines from the European Union. I just want to make sure that it's done right so that teeth are protected.
Love that so much. I'll be honest, I tell all of my clients to just go to your website because you guys are so science forward, and it's hard to find that these days. I mean, it's really hard to find that. I mean, you guys are so transparent about what exactly is in your toothpaste, where it was sourced from, making sure that it's clean, it's, not sneaky dirty. And because it's so hard to sift through that. And with so many products being, shoved down our throats, sometimes it's like, I don't know which one's the right one. So I would rather just, for me personally, stick to the science. I've had my daughter on your guys' toothpaste for ages.
Thank you.
And she loves it. I love it. My family loves it. And I really, really love the dry mouth serum that I use. Yeah, I love that one. So I use it before bed. I will say the first time I used it, I wasn't expecting it to not foam up at all. So I was like, what's going on here as I'm brushing my teeth with my electric toothbrush? And then afterwards I was like, oh, my mouth feels so good. Yes. So my mom has terrible dry mouth. And so I sent her a bunch in the mail, and she was like, Tasha, it doesn't foam. And I said, oh, I forgot to warn you about that. But she said, oh, it just feels so good.
Nice.
So I think that is such a nice option, because some patients that have really severe dry mouth, toothpaste burns and it hurts. And so the extra ingredients that we don't necessarily need can be like an irritant for them.
We've had some CPAP patients reach out to us to thank us for that dry mouth gel. And one of them was a husband of a hygienist. He reached out. He's probably in his mid-30s, and he's on a CPAP machine. And he said which gets us very, very dry, right? It really makes a dry mouth. And he said that his typical nighttime routine is to take a really large Yeti cup and fill it with ice and water. And he said all night long, he wakes up because he's so dry and he's slurping down that water from his cup. It's right next to his bedside. And he started to use our dry mouth gel, just put some in, before he went to bed at night, and kind of windshield wipered around his teeth so he felt moist. And he said he wakes up in the morning and his Yeti cup is still full. And so he was extra grateful that he's no longer waking up to have a sip of water because he was so dry from that CPAP.
Love that. I have a doctor that she was sharing a similar story, but in the practice, she was talking about patients that come in initially with that are really dry, and she'll just take that same gel, she'll swab out their whole mouth, and she'll say, now, how does it feel? And then she'll send them home with a tube and say, hey, just keep using this, because dry mouth it's so challenging. I mean, there's so many different reasons for dry mouth, from medications to menopause to hormonal challenges to sometimes patients just don't really know, Sjogren's. It can be such a challenge.
I think even in the younger set that sometimes we don't think about, the really young, if they have an anterior open bite, they probably have a dry mouth. The kids that are on inhalers for asthma, it causes awful xerostomia, dry mouth. And then also kids with ADHD, if their families choose to medicate them, Adderall and other ADHD meds really dry us up as well. And when we're dry, we are so much more prone to get decay. Saliva can't work its magic, right? There just isn't enough of it.
Yep, absolutely. So is there any contraindications for any person to use hydroxyapatite? So, we've been talking about children, so it sounds like it's safe for children, but is there anyone that maybe wouldn't qualify, a pregnant mother, a nursing mom? What's the...
here's the thing with hydroxyapatite, nanohydroxyapatite, is it's always in our bodies. And so our bones are constantly remodeling as we age. We are always making nanohydroxyapatite in our salivary pellicle, which is, that little kind of lining that we get to protect our enamel, always making nanohydroxyapatite. It's just part of our system. And so as far as using nanohydroxyapatite, it's really appropriate for anyone because it's already in us anyway. Nanohydroxyapatite is considered biomimetic, which means it mimics natural bone and enamel. And that's why orthopedic surgeons will coat artificial joints with nanohydroxyapatite because it helps them integrate into our own natural bones. Pharmaceutical companies use nanohydroxyapatite to make capsules around our medications. So when we swallow a pill capsule, the nanohydroxyapatite capsule actually breaks down in our stomach to just calcium and phosphate. And then the medicine is more available to our bodies.
So it sounds like if my kiddo is using your toothpaste, they can swallow it without fear.
To be honest, they probably are in other products anyway. There's many food manufacturers that use nanohydroxyapatite as a source of calcium and phosphate in their food.
I love it.
I know.
So speaking of swallowing toothpaste, let's talk a little bit about fluoride. So
Yes.
I have gone down the rabbit hole on fluoride versus non-fluoride and hydroxyapatite. And for my family, I've just chosen not to use fluoride just because from what I've read, the science is showing that hydroxyapatite is just as good without the potential negative side effects. I do have practices, though, that still want to use hydroxyapatite. And I know you guys have a super paste that has the hydroxyapatite and fluoride.
Yes.
Can you tell us a little bit more about maybe what's the same, what's different, the mechanism of action?
It's all in the way it protects the teeth. And so obviously fluoride is in the United States as a way to protect enamel and is regulated by the FDA. What fluoride does is it creates a really tightly bound surface of enamel. And it's called fluoroapatite. And essentially, it's more resistant to all of those acid challenges from our diet, right? Nanohydroxyapatite is totally different. It doesn't create that fluoroapatite layer. But what it does do instead is it grabs onto our plaque and our calculus and all those little bugs in our mouth. It essentially gets them out of the way so they can't cause the trouble that they normally do. So either way, you're creating a tooth that is either having less acidity around it or is more resistant to having that acidity. The one thing to know about fluoride is that it doesn't act alone. And we used to think it did. Okay, so when fluoride was first put in toothpaste in the 60s, essentially researchers then thought fluoride created fluoroapatite and protected the enamel. But we now know more about the biochemistry. Fluoride needs saliva. So it needs to be fluoride plus calcium and phosphate to create that fluoroapatite layer. And that's why we created super paste. It has fluoride, calcium, and phosphate all in the same tube. So those patients will actually get protection of fluoride by creating fluoroapatite, even if they don't have saliva. Plus, they get all of the benefits of nanohydroxyapatite as well.
I love that. So when it comes to concentrations of the fluoride, correct me if I'm wrong, but you guys don't really have a ton. Like there's so many prescription toothpaste that my sister just called me the other day because her daughter has some areas of demineralization on her teeth. They recommended a prescription fluoride toothpaste, 5,000 parts per million. And my niece is still in her teenage years. And so my sister said, I don't know if we should do that. So she called me and she said, Tasha, what do you think? And I said, I would rather you just keep using Dr. Jen's because 5,000, just a latte. So
yeah, it's
what are your thoughts on how much fluoride is really safe in the research?
I think even looking at the FDA, if somebody under the age of 16 is using prescription fluoride, there are warning labels on those tubes that say warning, pediatric patients ages 6 to 16 using this product need to rinse thoroughly after use, which is an unusual warning label. Most toothpaste say spit, but don't rinse. That's what the ADA recommends, except for 5,000 parts per million fluoride. It's a pretty big dose of fluoride. And even the FDA recognizes that we don't want children to swallow that much fluoride. And so it's really all in the dosages. And that's why for super paste, having a lower level of fluoride, it's 1,000 parts per million, which is just considered over-the-counter fluoride. So it's just a fluoridated toothpaste with the boost of having nanohydroxyapatite inside of it. It's actually been shown in Europe. It's been used in Europe, this combination paste, for over a decade. And there are tons of studies there that show that the combination paste will perform much better than a prescription fluoride will, mainly because fluoride needs that calcium and phosphate in the saliva. And usually the ones who are getting a lot of decay are probably missing some saliva. They're
Yeah.
low. They don't have the calcium and phosphate. You can throw all the fluoride you want at that system. They're not making more fluoroapatite. And so if you give them a toothpaste that already has calcium and phosphate in the tube, they're better protected.
I love that. That makes so much sense. Yeah, I mean, I think about all the people that I recommended a really high percentage of fluoride to that had dry mouth, thinking that that was going to help, not understanding that if they don't have saliva in the first place, it's not going to do what I'm hoping that it does.
You know, when our daughter was attending dental school, so she did get to dental school a little later. She needed a few years to recover from C. diff, but she was in dental school. She was in her pediatric rotation. And of course, this toothpaste is what we talk about all the time, right? She was in her pediatric rotation. She had a 12-year-old that was on an ADHD med with a lot of, kind of dry mouth, a lot of decay. And the faculty asked her to write a prescription for fluoride, 5,000 parts per million fluoride. And so she took her phone and she ran to the bathroom and she texted my husband and said, "What do I do? They're telling me that this, 12-year-old needs prescription fluoride. And I know that that's not going to work." And my husband texted her back right away and just said, "Cooperate and graduate." And so that's what she did. And she did graduate, but I think now that we know more about the biochemistry, it's clear that there are more modern ways to address decay.
Yeah. Well, and I think it's so fascinating to me just how much the science is changing and how much more we're getting exposed to now with just the World Wide Web, AI and all these research papers. We can, pull them up in the blink of an eye and really take a deep dive on really understanding these products so much better. There's so much information out there that it can be hard to sift through. I read the other day, it was something like 25 years before science gets into practice, and that's dentistry or medicine. And it's even longer in colleges because it takes so much time to change that curriculum and update it and everything like that. And so there's so much that we all have to learn to graduate. And so,
and
we all need continuing education. Thank goodness.
It's so true with, if you look at toothpaste formulations that we're all really familiar with and used, grew up with, a lot of them were formulated in the early 70s. They never really changed. And so they're still using the formulas from the science back then, but now we know so much more. And so that's part of why we're here, honestly, is I think we're using more modern science.
This has been so fun, so informative. I just have loved this conversation so much. Is there anything else that you want to share with us about Dr. Jen Natural products, something that we maybe haven't talked about yet? Because I personally love your products and trust them with my family and hope other people will check them out.
The only other thing I could add is that so many of those natural toothpastes that you see kind of everywhere, really backed by venture capital groups. And, CEOs of these venture capital groups, they don't do dental research. Dr. Jen, it's really what you see is what you get. It's just a family that wanted to do it right. We don't have investors or venture capital backing. So honestly, any kindness that you share with your friends or your patients, we really appreciate.
And I just realized I didn't mention one of your products, your floss. I love your floss. No microplastics, no hidden microplastics in there. I'm sure my listeners have heard about microplastics because we're all kind of a little bit nerdy and granola if you hang out with my clan. But there's so many hidden things in our floss that I didn't even realize that a lot of the natural flosses are recycled plastic.
They're plastic. And I really have, and I looked into this when Claudia was ill as well. I really have trouble with that because if we know that plastics and microplastics are not great for the human body, why do we allow, floss? It's going in our mouth. It's going through tight contacts. It's shredding. We're swallowing microplastics. And I think we all recognize how hard that is, especially on the female body. And so why in the world, do we do that? And I think 99 or 98% of American floss is plastic. And so we created a silk floss.
I love that so much. Dr. Jen, I so appreciate your time. I so appreciate you and your family's effort to make amazing clean products, being super transparent with the public about what exactly is in them. Thank you so much. And I wish you all the success in the world.
Thank you, Tasha. I appreciate being here.
Thank you. Thank you for listening to Mouthy Matters. If this episode helped, I'd love it if you shared it with a friend or left me a quick review. It really helps the show grow. And if you want a simple next step, download my 6-minute guide. It's in the show notes. We'll see you next time.